everyone. Hi, my name is Shweta, founder of Ayush for Life, Ayurvedic Holistic Wellness Center, and I'm so excited in the third episode of Holistic Healing of a Mother. We have a mother healing series going on in the month of May, and today we are inviting a very special guest from India, a homeopathic doctor, Dr. Yamini, who is going to talk about UTI, a very common disease that comes in at different parts of the women's life, and she wants to help us share her wisdom, share her knowledge on how to get rid of UTI using homeopathy. We are inviting all the Ayush professionals from different parts of the world to collaborate with us on this initiative where we are promoting Ayush systems of medicines. A for Ayurveda, Y for Yoga, U for Unani, S for Siddha, H for homeopathy. So welcome Dr. Yamini. I'm going to invite her and she's going to join us in a minute. She is here with us. Dr. Yamini, all the way from India. I am okay. Hello, Dr. Yam. I think, again, I'm so sorry. There might be some technical issues, but let's stay live and invite Dr. Yamini again. She's going to join us in a few minutes. We are going to talk about urinary tract infection, a very common disease that comes up with women. And I am going live with Dr. Yamini. Ooh. Sorry about the technical issues. Stay live with us.
Hello, Dr. Shweta.
Namaste,
Namaskar.
Dr. Yamini.
So finally,
we are doing the live session.
yes.
My voice is echoed again, just like last week. So over to you.
Yes, though I can't hear so much of echo, but there is a little bit of echoing which I can see. So tell me, how are you?
I'm doing fine. Great. How are you doing?
I'm good. Thank you so much. And thank you so much for inviting me for this beautiful series. This is
My
a very
pleasure.
nice initiative. And I really, I respect you for that you have taken this initiative for mothers. This is wonderful.
Thank you so much. So I was telling our audience that Dr. Yamini is a professional of homeopathy. She's been in the industry for over a decade now, and she has various patients, having different various problems from psychiatric to gastric problems using homeopathy. She's an expert and lots of resources and has opened up her own clinic in India, practicing over there for years now. And we are inviting all the Ayush professionals on this platform to share their therapies and how we can get rid of some common problems. For example, urinary tract infection, very common problem in women, and how they can get rid of UTI using homeopathy. So tell me, Dr. Yamini, why is it so common problem that we hear among in the women's age, in the women's health?
Yes. So you rightly said that it is a very common issue amongst women. And the major reason behind that is the anatomy of the women, how how the body is naturally. So because the urethra, the organ from which the urine comes out, urethra and anus, they both are very close in a in a female body. And that's why women are very prone to have such infections. Second thing is that they are also very prone to have sexually transmitted disease when they are sexually active. And that is also one more reason which adds to this urinary tract problem. And of course, after delivery and pregnancy, which is a very major part in females' life, and a lot of instrumentation happens, and a lot of aid should be given especially during delivery and postpartum. So that also adds. So there are so many reasons, but one major reason is the anatomy, which we have to, we can't do anything about it, but we can take some precautions to prevent UTIs in women.
That is great to know. And what those precautions can be in your point of view?
Yes, so I will talk about very simple things which you can do by yourself other than treatment. Of course, treatment is the last resort when you have infection. You should go to any women who is experiencing, this persistent urging to urinate or burning or any such symptom. You should go to the doctor. But before that, if you want to prevent UTI, which is a very common occurrence amongst all women, first thing first is drink plenty of fluids. So I have seen why women don't drink fluids, because they are so busy in their kids and their work, and they just forget about taking water. So hydrate yourself. At least 3 liters a day is a minimum requirement, no matter what kind of weather you're having or what are the other conditions. But 2 to 3 liters is just minimum that you should take. Second thing, hygiene, maintenance of hygiene. So of course, women are very particular about hygiene, but one thing which they should keep in their mind is that whenever you are cleaning your private area, then you have to wipe from front to back and not from back to front. So whenever you're going for a washroom, just wipe in this direction from front to back. That will help, because most of the times we see that this anal infections, if somebody has any problem in the GI tract, the gastrointestinal tract, your alimentary canal, that also goes to the urethra of women, because urethra is again very, very near to the anus. So when you're wiping like this, this prevents transfer of the bacteria. So this will also help. Third thing is, you should take care of your general health. If your immunity is good, if your general health is good, if you are into exercise, you are into plenty of fluids, your diet is good, then obviously the risk of infection becomes less, because general immunity to to combat any kind of bacteria or viruses is high. So that is one thing. And most important thing is, don't ignore yourself. Don't deprioritize yourself. Prioritize yourself as much as you prioritize your kids, your family, your husband, your parents, your in-laws. So that is very important.
That is great, doable tip. Very easy to do, and prevention is always better than cure. So take a preventive, proactive step, to help yourself prevent this, UTI infection. That is such a helpful, conversation, Dr. Yamini. My next, curiosity, my question that comes up is, most of the women who are working the desk jobs in corporate world, they are sitting on the desk hours and hours doing endless work. They often come to me having UTI problems. And of course, being an Ayurvedic expert, I solve their problems using Ayurveda. Do you have any tip for women who are working in a field, who are working on doing the desk jobs? Any one tip that will help them out?
Yes, so this is a very common problem that all the women who are working, they would come with UTIs, and I feel that the cause behind that is that they do not use washrooms often because they are frightened of using the public washrooms, and they,
Yes,
they would just retain in their bladder, and they
true.
won't go to office washrooms, and that's a big thing. And also sometimes you're so busy that you suppress your desire, you're urging to urinate, so don't do that. Of course, when you have UTI, you can take treatment, but just like Dr. Shweta said, that you have to prevent it. So if you're working and if you're outside, there are two reasons. One is they don't want to use public washrooms, and second reason is that they have this fear that we have to go again and again. So there will be frequent urination, which is a problem when you drink enough water. So but you have to take that thing. You have to hydrate yourself, even if you have to go 10-15 times in a day, that is okay. That's a complete natural process. And second thing, if you are frightened of using public washrooms, then I would suggest that these days a lot of sheets are available, the toilet sheets and sprays, which helps the prevention, just like these germ killing sprays and sanitizers. So they are available in the market. You can keep them easily in they are pocket sized sanitizer sort of bottles. You can keep them in your bag, and you can just either spray the sanitizer over the toilet sheet if you're
Yep,
really frightened of it, or you can use the sheets, the paper sheets. It's like a tissue
yep,
paper.
yep.
So it's very easy to use. You can use that and drink enough water even if you're outside. Just don't restrain yourself from
Yep.
going to washroom or taking water just because you're outside. That can't be an excuse, because it's an everyday job. It's an everyday thing.
That's thank you so much for bringing that up. That's a funny, incident. Many
Yes.
women, they will decide that they won't, drink enough water before traveling if they want to travel for 8 to 10 hours. So they'll restrict, that drinks, consumption, water consumption. This is a beautiful.
In my practice, I have seen a lot of women with, in earlier days, like maybe 20-30 years ago, these renal stones were very common in men. If we
True.
read our medical books also, it says that, men are more prone to have renal stones rather than women. But
True.
these days you will see that women have more renal stones than
Yep.
men.
Yep.
Actually, men have their own kind of, and that is because of our lifestyle, and it's nothing, it has nothing to do with the anatomy, physiology, and
Yep.
the race and all those things. Just because women do not hydrate themselves enough, and they are so prone to UTI, so this can lead to renal stones as well. So this is one complication which you should keep in mind that can
Yes.
happen to you.
True.
So don't do that. Please hydrate yourself. Take care of yourself.
Yes. Yes. Restating that, statement, take care of yourself, prioritize yourself. That's the epitome of women's health. You have to prioritize yourself. Okay, Dr. Yamini. So my next take on UTI would be, since you're a holistic practitioner yourself and really, great enthusiast, you want to, create awareness regarding UTI. Is there any specific food articles that you would like to share with our audience today from a nutrition perspective, that these food articles really help in balancing out the heat or cold levels, as per if I talk about acidic principles or acidic or alkaline levels, pH in the body when it comes to UTI? Any food article your favorite that you find that in your experience, clinical experience, have really helped your treatment?
So two, three things I will talk about. One thing is, I have seen that cranberry juice or cranberries, eating cranberries really help. They are great for kidneys. If you look at only kidney health, in men or women, whatever. But cranberries are really good. Juices of that really helps. It has proven medical utility also. When we talk about the medicines part, meds part. And
Yep.
second thing is all the juicy fruits. So all juicy fruits, all citrus fruits, they will help you a lot in keeping your kidneys healthy. So
Right.
try to eat them and try to eat more. I would also like to mention that when it comes to diet and lifestyle, it's very important because these days everybody is consuming packaged food and ready-made food and ready to eat food.
Yeah.
So that's a trend, and also we don't have enough time for preparing food and cooking food. But try to avoid packaged food as much as possible, because that is causing the preservatives, the color, a lot of things inside it
Oh yeah.
causes many problems. And women are facing a lot of newer sort of issues, like last time I remember you spoke about PCOD with
Yes.
Dr. Agrawal, I guess.
Yes.
So PCOD is one. The cause of PCOD is this preserved food and bad lifestyle. These
True.
are two important things. And in bad lifestyle, everything comes up. Not exercising, eating ready-made food. So try to avoid that. That also has effect on your hormones, your mind, as well as all the organs, including kidneys. It's not that you're eating anything crap and your kidneys will be healthy. Nothing will be healthy. So try to prepare homemade, home cooked food as much as possible. That is very, very important.
True. I completely agree, Dr. Yamini. Saying in Ayurveda, aharo hi te sambhava, which means that your food, your body is made up of food. So food is the only thing that connects you to the health and to the disease. So
Yes.
take care of your food, eating fresh food, home cooked food. If you have the privilege of, living with your parents, take help of them, take help from the community. Just, cooking, take it um, as a self-care practice, right?
Yes.
And
Yes.
rather than thinking of it as a chore, start, having that interest in cooking. Because once you have that, you will start doing more and more cooking, and that will, establish a good, healthy connection with the food, right?
Definitely. It's such a joyful practice to do, actually. All those who don't like to cook, or who thinks that cooking takes a lot of time, if you start practicing it a little bit even,
Yeah.
it would be very joyful for you. It will be, it will be a kind of a meditation for you. So it
Oh
will
yeah,
give you a lot of joy.
yeah, yeah. So one thing, before we jump to the next section of our session is, I often find, youngsters, Gen Z, they are more, inclined towards the convenient food, just like you mentioned, the processed food. So start building this habit when you are young. See your, parents, your mom, your mother cooking in the kitchen. Start establishing these habits early on in the life. That will really help you when you switch to high school or college. You go there, and you are not dependent on the hostel food, because
Yes.
I see, the youngsters, the young girls at the age of 20 to 25, they are very, very prone to having UTI. And when I talk about nutrition, because Ayurveda talks about nutrition when it comes to, achieving your health goals, or, getting rid of the diseases, what kind of food do you eat? So that's a very, very big, heavy talk that we always I do with my patients. So thank you for sharing. Cranberries are a great, evidence-based food items when it comes to UTI. Right now,
I always say this to my patients when it comes to nutrition, or cooking food. I always tell them, I say, you eat local and go global. So
yes,
you have to eat whatever is grown in your area,
yeah,
or in your vicinity, and that's very beneficial for you, because that's according to atmosphere, soil, and air.
absolutely,
And this is all about holistic living and holistic practices, that you understand all aspects of health and living. And if you don't aspect, you are only dependent on pills, or you think that only taking some medicines will help you. So this is a big myth. This is not going to happen.
absolutely. I agree completely, 100%. Um, again, this has often come up in the Ayurveda basic principles. Desh, call it as Desh. And Desh not as country, but Desh as your body and the environment you are living in. So it has a very important factor when it comes to, again, achieving your health goals or talking about, getting rid of the diseases. Beautiful. My next take on UTI, Dr. Yamini, would be homeopathy. Again, is a very holistic, pathy. The basic principles of homeopathic are a little different from Ayurveda. But tell us, walk us through how homeopathy can really help in relieving UTI. Like, what are those things that are, patients suffering from UTI should keep in their mind when it comes to UTI?
Yes. So thank you for this question. And yes, like you said, that homeopathy is also a holistic system of medicine which considers, and what holistic means where we consider person as a whole, and we are not treating parts of the system. So we are not treating only kidneys, we are not treating only UTI, we are not treating only anything, menorrhagia, PCOD, whatever problem, or renal stone, or cystitis, or urethritis, we are not treating that. We are treating that person as a whole. So we are not treating the ailment, but we are treating the person as a whole. That is a holistic system of medicine. And in that treatment, we include everything, the lifestyle of a person. We ask about how do you live, and then we give suggestions that what you should do. Then we take all the symptoms not only related to that system which is affected, but as a whole, how person behaves, how person feels, what is his symptom. So suppose in every UTI, you might see either persistent urging to urinate, or frequency is increased, or burning sensation, or there could be some pain in the back. With renal stones and UTI, there will be tremendous pain in the back and the renal region, along with chills, fever, nausea, vomiting. So many symptoms are there, but this some small quantity of urine along with this undone feeling is a very common thing. So of course, all most of the UTIs will present with this symptom, but we are concerned about person's symptoms along with the disease symptom.
Absolutely.
So if person says that doctor, I feel that I'm not able to go to office because I have UTI, so his emphasis is more on office rather than the UTI.
Yeah.
So that becomes a symptom for us, for a homeopath. And based on that, we prescribe individualized treatment, individual remedy, which matches with the symptom complex.
True.
And what that remedy does in the body, it is not like antibiotics or steroids or things like that, which is in modern medicine. So it is not killing the bacteria, it is not killing the virus. But what it is doing to you is, it is just preparing the inner lining of your urinary tract to combat the bacteria and virus.
True.
So what we are doing, we are just strengthening our own army, that you go and fight with the bacteria. So we are not killing anyone. Our medicines are not killing the bacteria, which is a very violent way of, of treating the disease. But sometimes that is required. So we are not doing that, but we are preparing our own immune system or immune lining against that bacteria. And we are just strengthening the body not to have all these symptoms and problems. So this is how homeopathy helps. And 2-3 advantages of using homeopathy in UTI is that you will get rid of all the side effects which you could experience when you are taking antibiotics, because prescription of antibiotics is a very, very common phenomenon in UTIs, and that has a lot of side effects. First thing. Second thing, after using antibiotics, the immunity gets decreased. Because of that, again, repeated UTIs happen. So it's a vicious cycle, that once you get it, you take antibiotics, second time you get it, you again take antibiotic, and third time you'll definitely get it because you had the all these things. So this can be reduced. Second thing, mostly I want to mention, in pregnancy, when UTI happens in pregnancy or after delivery, there is a limitation that, how much medicine you can prescribe, because then the baby is concerned, lactation is also concerned, and there are a lot of complications if we don't treat it. So we can't left it untreated. So in that case also, homeopathy is safe, very effective, very quick, and totally side effect free. So like Ayurveda and homeopathy, I guess both are side effects free and very, very safe systems of medicine which you can use. And one biggest advantage is your kidneys will be saved, your liver will be saved, you won't have any side effects in future as well. So it's a very safe way of treatment, and also individually designed for you. It's like customized thing only made for you.
I would like to highlight one point, Dr. Yamini, that you mentioned that Ayurvedic is now homeopathy. You are an homeopathic expert. I'm no expert. I don't know about this therapy. So you mentioned that it's side effect free. So there are no side effects in homeopathic medicine. But like Ayurveda does have side effects. If you take any medicine without supervision of an Ayurvedic expert, even normal turmeric in our kitchen, if it's taken by certain Ayurvedic bodies, it can be a little tricky. So be very careful while you are taking all these systems of holistic systems of therapy for your health goals or for being disease free. Just have all these systems management with guidance of an expert. Do not self-medicate. So often, what people here looking is they are looking at some homeopathic medicine that can help them with the UTI. But little do they know that every person is different, every body type is different, and we have to formulate all those, diagnosis first and then come up with a solution, right? So, whosoever are looking at live, please a humble request from expect from the experts of different therapies over here, Dr. Yamini from homeopathy and myself from Ayurveda. Do not self-medicate any medication.
Yes.
Whether it's homeopathy.
That's very important, Thank you for mentioning this, because this is very important. When I say that homeopathy doesn't have side effects, that doesn't mean you can take any medicine and say,
Yes.
there is no side effect. Please, for God's sake, don't do that. Because if, we should say like this, that it doesn't have side effect if it is, it is taken under a qualified physician. And otherwise, you can overdose yourself and things like that. So don't do that. Of course, meet a doctor. Don't depend upon Google doctor. Don't Google your everything about health problems, and don't diagnose yourself on your own, because medical practitioners dedicate 14 to 15 years to learn these things, and still they are not that confident that they have to study very hard. So it's a very important thing that you do not self-medicate at all, and don't depend upon Google prescriptions as well. I would say, please meet a qualified physician, and they take help of them. They will help you. Ask all questions you have to them, and it would be easy for you.
Thank you, Dr. Yamini. Any last thoughts on the topic for our audience before we wrap up this?
So I just wanted to say that women. My important message to all the women, all the mothers who are watching this and who will watch this, is prioritize yourself, prioritize your health, because if you're healthy, you will be able to take care of all the family members. And don't ignore small issues, because they can lead to something very big. For example, if we are talking about UTI or renal stone, even if it is a small stone or a very mild infection, and if you think that just taking water or taking some home medicines or that will help you. Of course, that will help you in a, in a small manner. I'm not saying that that doesn't help at all. That help you, but that might not cure your problem completely. And what it can do to you is that you will have bigger problems like, swollen kidney, hydronephrosis, some chronic kidney disease. It can also lead to so many heart problems and lung problems if it goes beyond the limit. And also persistent thickening of the kidney, which we call as that kidney becomes small, and it is called as CKD later.
Yeah.
So don't try only self medication. Only home remedies, sorry, not self medication, only home remedies or hydration. That is one way to get rid of it. But yes, please contact the physician as fast as possible for yourself, just like you do for your family members. So don't think that, okay, I'll be okay and I have a lot of things. Of course, you have a lot of things to do, but your health is your priority.
It was such a pleasure talking to you, Dr. Yamini. I really felt it. We are just like two friends talking on a single topic. Thank you so much for your precious time and coming on our platform, sharing all your wisdom and knowledge. I hope we will see you again on this platform, talking about some other disease. We are creating that awareness for our audiences. I wish you all the best, and I know it's night time there, so enjoy your dinner. I won't take long.
Thank you so much. Have a good day to you, and thank you so much. I'm so grateful that you invited me here.
Thank you,
You're
Doctor.
doing amazing work. My best wishes to you.
Thank you.
Thank you.